Let me give you a difficult one. So diet. I'm sitting in front of you and I'm saying varied diet, fermented foods, fiber, except, and it's going to be hard to get enough fiber on board. What are you advising me?
I think that the only compelling evidence that I've seen, and it's not, again, the highest level of evidence, is this retrospective paper in Science looking at fiber from Jen Wargo's group in the context of melanoma. I think that was using a retrospective dietary tool, right? So it's not the highest level of evidence. They do have a beautiful study that's ongoing now looking at a high fiber diet where food is actually shipped to patients, right? They have these prepared meals with like nuts and berries and snacks and breakfast, lunch, and dinner throughout the course of the day. So I think that fiber is kind of where it's at. I see very little downside in doing it. But I think we also need to be sort of clinically sensible about it in the sense that if a patient's on, let's say, Cabo and they've with nivolumab and they've got profound diarrhea, well, maybe adding a lot of fiber to their diet's not the best idea in that context. You might increase bowel motility. So it's that general recommendation for increased fiber, couched with a little bit of pragmatism.
Okay, that makes perfect sense.